Welcome to Hope Blooms, a podcast from the Early Pregnancy Loss Association.
At EPLA, we seek to support women and families suffering early pregnancy loss by providing resources, education, and community. It is our vision that no one suffers miscarriage alone. Welcome back to Hope Blooms. I am EPLA's Executive Director, Emily Carrington.
And I'm our president, Maria Servold.
Today, we are going to talk about a report that came out over in the UK. I've got the paper here right in front of me, the policy paper titled Government Response to the Independent Pregnancy Loss Review, Care and Support When Baby Loss Occurs Before 20 Weeks Gestation. So this is a really interesting report and recommendation. It looks like the review is obviously independent, and it's a series of insights and recommendations that came from talking to families and
real people who have suffered miscarriage.
Real people.
Yeah, which this was just the government's response or plan here was just released within a week, the last week. So it's
yes, this was
brand
published at the end of July.
Mm-hmm.
So, yeah, I just want to talk through some of this stuff. I think we just dive in at the beginning. We'll include the policy paper
in the episode,
in our episode notes, so you can see more. I just also love how human this review is reading it. You know, it starts with the first sentence. Pregnancy for most people is meant to be one of the most wonderful times in their lives. Mm-hmm. While most pregnancies have happy outcome, for some families, their dreams and hope of new beginnings are cruelly cut short. Mm-hmm. Then it goes into the statistics. 250,000 pregnancies in the UK are estimated to end in miscarriage, which is similar to our US numbers that said estimated 1 in 5, which is about the same as us. And then it talks about ectopic pregnancies, molar pregnancies. It also talks about decisions to terminate. So it's a very thorough review and really doesn't focus on politicize. It's not really law. It's all just recommendation for better care. So I think that is really, really interesting. And together, we will not talk about all of these, but they came up with 73 recommendations to set out a comprehensive plan for changes in the NHS and wider society to minimize the trauma that pregnancy loss can bring. What I feel like we've been trying to do.
Yeah, right.
Right.
There's somewhere, I don't remember where it is, but it says something like in the past, miscarriage has been viewed as like a random medical event that medical staff deal with. Kind of, sort of like, this is the thing that happens, but it's just a random thing that requires you to see a doctor, and that's it, right? And that's, they're sort of making the point, it's more than that.
Yeah. So I think it sets out to do an interesting task. It concludes, in meantime, women and families should not continue to suffer unnecessarily. This response sets out how we will prioritize the recommendations that we can act on urgently while working on medium and long-term system reform as well. So I want to focus mostly, obviously, we're located in the United States and have U.S. healthcare. So as far as how the government and their healthcare works, that's not going to affect our services.
Yeah. The one thing I think I understood from that, people know in general, is sort of like, unless you go to some specific private thing that costs a bunch of extra money, you get what you get, right? Like from the NHS. And then, and if their policy is this one blanket thing, it's not going to change from doctor to doctor, right? Whereas here, maybe it might be easier to find a different approach or whatever.
So I don't know that our solution is to come up with a similar type of review, but I think the review heavily informs where these gaps are, whoever's meeting these gaps, whatever systems you have in place. I think that is applicable across cultures, cross country, cross medical care.
And the recognition that there are gaps.
Yeah. Oh my gosh. I love that it recognizes.
Yes. And you're right that it does sound human, which I think the independent group putting their view together wasn't just, like government officials, right? It was people who are involved in this, who care about this. One of the women at least has been through it, it said. And so it's people who have been in that world doing this thorough review and then the government recognizing it.
The other thing I love that it recognizes, I think this is something we're challenged with, Our vision is that no one suffers pregnancy loss alone.
Mm-hmm.
Our vision is not actually that no one ever suffers pregnancy loss.
Right.
While I think there may be things around the edges to help with that, the reality is a large majority of pregnancy losses, early pregnancy losses, are fetal abnormalities and will not be avoided.
Right.
And they set that out that while it currently might not be possible to prevent many pre-24-week pregnancy losses from occurring, much more can be done to ensure that each grieving parent receives excellent care and compassionate support. I agree.
Yes.
That's what we're here for.
Yes. And it's great that they're so straightforward. We don't know why this always happens. Many times when this happens, there's not a solution. There's not a pill you can take to avoid it in the future.
Right.
But that doesn't mean that there's not still things to fix about it.
Right. And
Which
I think
is how we treat people.
Yeah. And I think it's because it's hard to eliminate. Somehow we've decided we just ignore it.
Because unlike other medical conditions, which miscarriage is not really, but it's like, oh, you have problem X. Here's pill X. Solve problem
Let's try
X.
to prevent problem X. Let's try to fix problem X. Yeah.
Right.
All right, we'll just talk about their immediate actions and what they want to do and implement right away. So the first one is a certificate of baby loss. The government must ensure that an official certificate is available to anyone who requests one after experiencing any pre-24-week loss. And then there's information here, what should be on the certificate. It does look like this is a voluntary certificate. This would not be a perhaps legal death certificate, but it will be, it says the certificates will not be legal certificates, but will be official government issued ones and should look official rather than just commemorative. As it is crucial to families that they have official recognition of loss.
Interesting.
I think it's huge.
Yeah. Because otherwise, where does that baby exist except in your memory, And and I think we've discussed before, but here in the United States, it's like everything varies state to state. And we know we've had friends have struggled with getting the death certificate, when it's for a miscarriage and that kind of thing. Yeah. So that's helpful.
I think as far as recommendations go, making it voluntary, it does talk a bit that some people find it distressing not having one. Some people find it distressing having one.
But having like an official option available to everyone is helpful.
Death is distressing, but I wonder if this is a good place to start. Even when it's distressing and hard, making it real helps.
Yeah. Well, that's one of the things we've talked about in various ways over the years is lost mothers can and do feel like it wasn't real or it isn't real because it's not recognized in the same way. Right. So it's sort of a step toward that.
Yeah. So this talks about it being voluntary and that their findings did reveal, it looks like in talking to parents, that it was perhaps split. But it talks about validating their loss and that they're doing a test launch with it and doing a rollout during International Baby Loss Awareness Week this year.
Is there the same time of year? Okay.
It is. It's a month is October but International Baby Loss Awareness Week this says 9 through 15 of October. So.
Okay. Related to the certificate, isn't there something else included about, several things? Providing, if you have the remains, providing a special container.
So that's the next thing.
Okay.
Sensitive handling and storage of pregnancy loss remains. Story time. Hard to hear story time. We've talked about it before, though.
The lunchbox.
My lunchbox, right? I mean, and actually I have two stories that are both of my stories that we've talked about before. With these recommendations wouldn't have happened. My second miscarriage at home, I found the remains. I put them in a Tupperware. I put the Tupperware in a lunchbox and put the lunchbox in the freezer. There it sat. And I took my lunchbox, handed it to the doctor for testing. And this acknowledges that situation directly. Right. And I'm not sure how they're going to solve this. But so that would be a home miscarriage.
Right.
And it says, so
Maybe it'll be that there'll be something available they can pick up wherever.
Because it says appropriate and sensitive receptacle to collect baby loss. And they address both home and medical facility miscarriages. And it says facilities should ensure that cold storage facilities, such as a dedicated refrigerator, are available to receive and store baby remains or pregnancy tissue 24/7 so that people aren't asked to store them in their home refrigerators. Oh my gosh.
Wow. Yeah.
If I could just take it, give it a receptacle
to the place that you already know is established to be,
So like one way this could play out, you have your missed miscarriage. You get handed your care kit, much like what we provide. In that care kit is a respectable, appropriate receptacle of the right size.
And then you know where to take it.
And then when you're done, you are a support person, take it. And it doesn't sit on top of the ice cream or beside the ice cream or...
Right.
And you don't know what to do with it.
Right.
Oh my gosh. That's amazing.
You can see the influence here of people who have been through this and, these specific recommendations.
Like that is such a specific problem. And it says women going through pregnancy loss before 20 weeks are faced with the question of how to handle the pregnancy remains and fetal tissue. Each parent facing this will have their own personal beliefs and views. The clinicians need to provide them with the information they need, support their decisions, and treat any pregnancy remains of gestation with respect.
Right, which, we've talked about that here as well.
Let's get on to the next. It should never be acceptable that fetal remains are treated like waste products. Story number 2, which is actually story number 1 in chronological order. And parents should never be asked to store fetal remains in their own refrigerators. So the second guideline in that, so my first story, my first miscarriage, when I asked what was going to happen to the body, it would be thrown out with the medical waste.
Right.
It was just crushing.
Yes. And so this is saying that can't be the policy anymore.
That can't.
Right.
So I'd have to look closer to see what actual disposal.
Right.
Because this does say there's some, I think I read, it is considered part of the mother's tissue, but this still said, yes, the disposal of pregnancy remains, which are considered to be the mother's tissue, is not, however, within the scope of the HTA's regulatory limit. Service providers such as NHS trusts that are involved with the disposal of pregnancy remains should self-assess and monitor their compliance with this guide. Okay, so now we're getting into some procedural matters that don't matter. So obviously, I'm not going to get into the waste disposal, and it really doesn't get into that. But I think it gets into what matters.
Right.
And so it says receptacles for sensitive storage of pregnancy loss remains. It acknowledges that losses might occur in a clinical setting, such as a hospital emergency department. If a first trimester miscarriage is expected, some women will choose to go home. That's what we just talked about. To ensure this is not the case, we will place and develop and create a bespoke receptacle to allow fetal remains to be collected and stored with due dignity. And it talks about not putting them in bedpans and kidney dishes.
Right.
Like, this is just amazing.
Yeah.
I mean, in some ways it's amazing that we've been doing this, but in other ways, just the dignity given to this human. We're not just going to put them in a bedpan.
Yeah.
And I think that matters to the mother. And matters
so much. Yes. Well, and I'd imagine some hospital employees would like to treat with dignity and respect the baby, but there's no mechanism in place or no...
Right. I'm thinking
or they're trapped in their rules or whatever.
Right. Yeah. How this helps empower nurses and doctors. So
and also, I mean, I sort of said, like, these things are going to be available. It's like no one's going to be forced to do whatever from the parent's perspective, but to have it available and sort of standard practice to offer it is a huge step.
Yeah. Just having options available and a path forward and a way to do things. The next one is, which I was affected by this one too, care for sporadic and recurrent miscarriage.
This is the part that I actually found the most interesting. Well, so you explain it, but
Well, it essentially is saying right now the standard of care in the United States too, so I guess all over the world, based on this, you don't test why miscarriages are happening till the third miscarriage. Well, my doctor I was lucky. He was willing after my second, but that was lucky.
Mm-hmm.
And after my first, I feel like we could have found answers.
Yeah, potentially.
But nobody looked.
Well, and I think, so like even, I mean, again, from what little I know of how their healthcare system works, even the chance of being able to find a doctor here who, was willing to go look after two, you may not have that there if they're all working on this like hospital, national system. But what does this say now?
So this is saying now that following the first loss, they can request an appointment with their general physician and a person-centered consultation should be offered. Then, if appropriate, the individual's baby loss experience and future pregnancy should be discussed. Information about impact on mental health and trauma. And individuals should be advised that they can self-refer to NHS talking therapies. Clinicians should actively encourage the self-referral.
So that to me sounds like after a first loss, before they maybe were like, yep, okay, can't do anything for you.
Yeah, so it sounds like after the first loss, they're really focused on
helping with the emotional impact.
I'm reading here a little bit. And mostly providing the educational information, like we all said, and access to support groups, therapies, counselors, etc. is what I think I'm understanding that to be. And that clinicians should really encourage self-referral to therapy. Yeah, following the second loss, an appointment should be made for blood tests, including a full blood count and thyroid function.
Yes.
Oh my gosh. And other necessary investigators. Depending on these tests, along with other pre-existing or chronic physical or mental health conditions, referral should be made to the relevant specialization. Had we tested my thyroid after my second loss, I mean, I guess it was after my third loss we finally tested my thyroid. And I think things have come a long way on that in the last 10 years. And then following a third loss, a consultant-led appointment should be offered at special recurrent miscarriage center where possible. So additional tests, including genetic testing, scanning, screening, and treatment may be offered. And it says the standardized primary and secondary care clinical guidelines should include flexibility to accommodate and prioritize differing factors, such as maternal age and recurrent loss. And I want to talk about testing for just a second, because we just said it's not your fault, which is true. But then there's this whole field of testing, which is, it's kind of hard to get your head around. Like, you couldn't stop it, but you might be able to fix it, is a little heady.
Right. Like, there's things you can do, even though we say there's nothing you can do. But,
right.
But I do think the majority, I mean, and correct me if I'm wrong, but from what we know, it seems like the majority of miscarriages are due to some sort of fetal anomaly that's not fixable by anything you can do. Yeah.
But then you also, so we still don't know, and it is hard to know exactly, but we tested my thyroid after my third loss. We fussed with my thyroid levels, and then I had 2 successful pregnancies. It's at least worth a try. Right. And I feel better. My thyroid levels are right. So there's these things that
what I like
aren't
about
going to save it necessarily, but could help support.
And putting it in these recommendations and sort of this procedure makes it so that most of those doctors will then sort of have to go through these steps, as opposed to you being like, hopefully this one does. Who knows if this one will? Let me try to find someone who might care. Right.
And I love this sentence. We agree with the recommendations that pregnancy loss needs to include plans for ongoing care after every loss. Yeah.
Right. Not just like, sorry that happened. Thanks. Bye. And one of our board members told us recently that when she had a loss shortly after moving here, and because she hadn't established care with any doctor yet, it was like no one could help her, because it was not her first one. She sort of knew what to expect because she hadn't yet gone to a normal visit. Everyone was like, sorry, can't help you, which is, sad.
So terrible.
This will sort of kick that system into gear, I guess, right?
I think
get the ball rolling for people.
Realizing this is, required ongoing care. I think about I remember after my first loss, I went to go establish care with a new doctor because we had moved, and was asking questions about getting pregnant again. And it was pretty much like, oh, we don't even worry till 3 losses. So like this idea of ongoing care that I even had a problem, like.
Right. And it's sort of like they're saying to you, you have to suffer more heartache before we're going to make it'll be worth our while to see if there's a problem.
Yeah,
you know?
it's strange.
Yeah.
I think I like this too. We recognize that implementing a service that would offer testing and investigation for women who experience 1 or 2 miscarriages as a standard of care will require significant investment and recruitment and training of specialist staff. Yeah, this is really huge. But here they say like they want to work along with Tommy's Miscarriage Center, which is a nonprofit, I believe, a large organization over there.
So yeah, helpfully deferring to people who are experts in this.
Yeah, there are so many times throughout here where it's like, let's talk to Zoe and Sam who like did the study, or let's work with this organization. It really acknowledges that this is sort of a community effort. So the next section, it said, was bereavement. Increase capital investment to ensure adequate facilities for bereaved parents. Bereavement suites, counseling rooms, private spaces should be available to all families, regardless of baby's gestational age. Women and their partners should not be expected to receive unexpected bad news, discuss treatment options, or grieve in public spaces.
That's helpful. I mean, because think about all the times it's like me in the ER. You know, and it's like you're divided from someone else with a curtain, and you know, yeah, it was not a dedicated space.
And this talks about resources, workshops, training sessions, support meetings. Because I think it's important. You can't just build the room, right? You've got to have the support,
right?
But also that space, having space, I think that really matters.
Were there other major recommendations?
Yeah, there were a couple more. Let's see. The next one was, this is more of an employee recommendation. Oh, this is interesting. These are recommendations for paid leave for NHS employees.
Oh.
It says the NHS should be a leading example in offering excellent bereavement support and leave to staff who experience pre-24-week baby loss. So taking care of their own. And they recommend up to 10 days of paid leave for the person.
Wow.
For the pregnant woman.
Yeah.
And 5 days for the partner. I took none.
Yeah.
3, 4. I came to work 2 days after my DNC. And I've said this before, right? Like, I had a wonderful employer who cared for me, but I didn't know what else to do.
Right.
And I think had I been given 10 days leave, it would have guided me in my grief.
Yes, right.
It would have stopped me and would have said, like...
It's someone saying, hey, this is real and it's okay to take this time off, so you should take this time off. As opposed to, well, I guess I should go back because I kind of feel okay.
Right, and then I'm at work, I'm like, what's happening to my body?
Right.
If someone would have been like, no, grieve now.
Yeah.
I would have been like, oh, I should do that.
Yeah.
I think that is a great example. This is one that's near and dear to our heart. Education, training, and information. Posters with what to do if you have pain or bleeding during pregnancy to be made available to general physicians, sexual health clinics, pharmacies, women health hubs. Yeah.
Right. Just information.
The QR code link to more information.
Yeah.
And should have space for contact details for local services.
Yeah.
We're working on posters like that now.
For our small little area, in places that women are where they can see it and find help. Yeah.
Right. And if you start bleeding, here's what you should do. Information leaflets, bereavement support booklets, and bereavement resources. This is what's in our care kits. This is what we started with. This was one of the first things. You know, we sort of did this project ourselves, right, with 15 women over lunch. In those early analysis days of what were our experiences and what we're missing. And this big study is saying the exact same thing our room of women said.
Yep.
And they're coming up with good things. Ensure a directory of services, which we do sort of a resource guide.
Right.
But that everyone knows. I don't know how often I answer people's, just send people other people's websites and resources and access. Because they don't know.
Right.
They don't know where to look.
Where to start. Yeah.
Yeah. evaluation and piloting required to develop screening tools and pathways for women and partners suffering mental illness as a result of baby loss. I think that's one. People underestimate the emotional distress, which we talk about as well. Pain management research, often left without suitable pain relief. I think that comes from the big old fat lie that it's just like a heavy period.
Right.
Just saying to someone today, like, it was more like my live births, minus the end part.
Right.
But the contractions and the preparation, the pre-labor, it was very much like my early and pre-labor. And then it looks into minimizing risks in socioeconomic and minority communities, and where are those high risks and what could be done to help. So they do look into some prevention, but I think they largely acknowledge that
how to take care of people when this happens,
how to take care, and then how to better equip their clinics.
Yeah.
I agree.
Yeah.
Right. Right. I think this is really telling.
Right. Well, and it's, the whole thing of their health care versus ours, it's they can, because it's nationalized, make these recommendations, and it applies to a lot more physicians. But whatever, we can look at this here and, we can be inspired and continue to encourage.
We can be guided by this. And I think it's worth it to dig into some of their studies and this desire for dignity. I really admire that it really cuts to dignifying the family and the lost and validating the loss. And it's not overly flowery. It's not syrupy. It's not emotional.
Right.
It doesn't feel charged in any way other than just, we can do better. We can do better. I think we can, as a nonprofit, I think we can look to some of these recommendations. I think these are great for nonprofits like us to, as we talk to doctors and hospitals and nurses, hey, look, this study's been done. This is what women want.
Right.
And these are the recommendations being made.
Right.
And we have the resources to help you do that.
Yes.
We have most of these things.
Right. Yeah, like the container and the information and
I didn't look into the medium and long term. I know we've been going on here, but one thing that didn't come up that's obviously super important to us is the cost. Now, maybe that's different with a nationalized healthcare system. And they do talk about needing resources.
Right.
I think this is a great place to start. Great to-do list, things that we aren't doing.
Right.
We can do better, ways we can work with doctors and hospitals. So, like I said, I'll post some more information about this in our show notes. And I think it's a great beginning. So thank you for sending this across my desk, my phone, my
I
email.
saw a random Instagram post that was like the ladies who sort of started the whole research thing. And from that, here we are. So,
all right. Well, great.
Social media.
Thank you all for listening, and tune back in next time. Thank you for listening to Hope Blooms, a podcast from the Early Pregnancy Loss Association.
To learn more about how we and you can support women suffering early pregnancy loss, visit our website at miscarriagecare.com or find us on Facebook, Instagram, and Twitter. Thank you for listening.